world is witnessing an increasing number and variety of mass gatherings, either in pre-planned events, large-scale accidents, or natural and man-made disasters. Mass gatherings represent risks to health and security, whether they are carefully organized and held at specific locations or occur by chance. Typical examples might be gatherings, religious, social, or sports events. Characteristically, these events vary both in the numbers of people attending them and the period of time over which they are held. This has implications for the effectiveness of the dissemination of promotional messages or vital information to the public who attend, and has either positive or negative health impacts. Mass gatherings have significant implications for public health beyond the acute public health events phase. There is a variety of reasons to identify the various types of potentially life-threatening disasters and crises during mass gatherings and the dynamics of these events. There is also a consequent need to recognize the strategies that contribute positively to effective health services and to develop logical solutions and necessary logistics for their implementation. Saudi Arabia's government has accumulated a wealth of knowledge about risk management during mass gatherings through many decades of planning for the annual Hajj, one of the largest regular mass gatherings in the world. It requires all government sectors to plan and coordinate for the whole year in advance to prepare increased capacity in the health infrastructure to anticipate possible health challenges. The Ministry of Health implemented a range of programs to address these public health challenges, and as a result has become a role model to the world with regard to mass gathering healthcare facilities. These proactive and anticipatory programs include the provision of mobile hospitals and healthcare centres equipped with the latest emergency management medical systems and staffed with hundreds of thousands of specialised personnel to provide free, state-of-the-art healthcare services. These preparations, in addition to active surveillance for disease at ports of entry and among Hajj camps and hospitals in Hajj premises, were successful in halting further spread of infectious diseases. The accumulated experience in healthcare delivery during such events justified the establishment of an advanced healthcare provider training program which meets and fulfills the current needs and exceeds the local levels of demand and elevates the response capacity to regional and international dimensions. These annual events pose exceptional challenges to the healthcare system to reduce the incidence of illness and injuries during mass gatherings, because they need to extend to and access effectively more distant populations through the involvement of mass media and social networking. With the aim of ensuring the safety of the community, professionals studied a range of mass healthcare management techniques, from early, responsive, promotional and preventative methods to outreach services for safe clinical care in discrete healthcare facilities at all levels of health-related problems. Saudi Arabia consequently implemented programs to include health screening as the people enter the country, free healthcare during the Hajj, stepped up infection control efforts in hospitals, and increased the number of personnel to staff healthcare facilities surrounding the pilgrimage sites. The organisation and delivery of effective healthcare systems ranged from ensuring rapid access to the injured or ill patients, providing effective injury stabilisation, on-site care for injuries, and extended to on-site critical medical and extensive surgical intervention. Effective planning on handling health risk during mass gatherings will strengthen global health security, prevent excessive emergency health problems and associated losses, and mitigate potential disruption in both host and home communities. A closer look at the international practical experiences acquired in similar circumstances to promote the efficiency of health procedures applied, taken to gatherings and large accumulations of people will revamp mass gatherings and global health security. It will become both benchmark and roadmap for dealing with emerging microbial threats.